as the expulsion of an embryo or fetus before it's viable. And that viability is usually before 20 weeks of gestation that we see in abortions. Let me rephrase that. Viability is after 20 weeks, right? And that just means that a baby is able to grow outside of the uterine environment. So typically that is after 20 weeks or 500 grams. When we talk about abortion, abortion is a pregnancy that is terminated before that 20-week marker. All right. And there are different types of abortions. Some are spontaneous, where the mother is unable to stop the progression of her cervical dilation, or some are elective, where they are inducing that premature labor scenario, cervical dilation scenario. So 47% of all abortions globally are unsafe. Usually it is the developing countries who are performing abortions under circumstances that are not ideal for the mothers. Okay. So let me make this bigger. So the risk factors for abortion are here. Ending a pregnancy early comes along with advanced age. Okay. And advanced maternal age. I was really shocked because when I had Shiloh, I was after 35 years old, and then I was considered a geriatric pregnancy. So it was just like, what? Like me? But yeah, in maternity, you age very quickly. So advanced age, previous miscarriage, previous elective abortion, uterine abnormalities such as adhesions. And adhesions are where you have the fetus, or I should say embryo, the embryo is attached to the endometrium and there's like scar tissue there. So sometimes the uterus is adheres to the lining, right? Or the embryo is stuck to the lining. And so that can cause abortion. Prolonged time to achieve pregnancy as well. Smoking, alcohol, cocaine use, high caffeine intake. These are lifestyle things that induce abortion early on. Some other risk factors include low serum progesterone. Progesterone is a pregnancy hormone that is responsible for keeping a pregnancy going. So if you don't have a high progesterone level, then yes, your body won't know to keep a pregnancy going. Celiac disease, polycystic ovarian syndrome, thyroid dysfunction, all right, which is a thyroid condition, or Cushing's syndrome, which is a corticosteroid issue, too much of that. Systemic lupus erythematosus is an issue. Infection, fever, trauma, low BMI. So a person who does not have a lot of body fat, less than 18.5, can also cause you to be at risk for premature labor or abortion. Let's talk about the signs and symptoms of abortion. So during a normal pregnancy, you would not expect to see these things. These are abnormal cues that need to be noted. The first is a spontaneous vaginal bleeding. During pregnancy, bleeding is always something that needs to be noted, and the healthcare provider should be notified for that. Low uterine cramping or contractions, blood clots or passing tissue through the vagina, and then also hemorrhage and shock as well. When we talk about types of abortion, there are several types of abortion, and the definitions give you an indication about the circumstances surrounding that particular abortion. So for example, miscarriage, this is a commonly termed spontaneous abortion. So with a spontaneous abortion, that means that the pregnancy has ended because of natural causes. Also with the miscarriage, typically it's something that the mother is not able to prevent from happening. All right. Induced abortion, this is an elective or therapeutic abortion. And there are reasons why some women would choose to have an elective abortion. So I think there's a stigma surrounding this term abortions in general, and they are automatically taken to a negative factor, like it's a negative thing, an unwanted pregnancy. I think they are usually considered elective measures, but there are natural abortions. There are abortions that are, inevitable, and the mother doesn't even, know how to stop it from happening. So yeah, there's many types of abortions. And then this other one that we have here is a threatened abortion. And this abortion is significant for your nursing exam because with this abortion type in general, you have spotting and cramping. However, you don't have a cervical dilation. And so because of this is the abortion where you try to do everything you can to save the baby and the mother, right? So with the threatened abortion, this is where you typically see all of the interventions happening for the mom. So, we want to save the baby. So we put the mom on complete bed rest, no bathroom privileges, right? We want her to keep herself in a calm environment so that she can keep the baby inside growing until it reaches the age of viability. And that is the main nursing consideration for threatened abortion, because you don't have cervical dilation, and also the membranes of that fetus is still intact, right? So we want to preserve that. All right. Inevitable. I alluded to this, but inevitable abortion is where you have spotting and cramping, and watch this, the cervix begins to thin out, it begins to dilate, begins to be dilated and effaced. And so this is one where sometimes it's nothing that can be done about it. It's going to happen for the mother. Incomplete abortion is one where you no longer have a viable pregnancy, but some of the parts of conception are passed while others remain. So it says here, loss of some of the products of conception occur. So maybe the mother is passing meaty tissues, parts of the baby, a lot of, blood is happening, but there are other parts of conception that are not passed by the mother. So most often it says here, the placenta is retained. And when we talk about NCLEX, even with a full-term delivery, we always have to watch for parts of the placenta that are retained, okay? The complete abortion is a loss of all products of conception. So that means that the mother has passed all the parts of the conception. And if you were to go looking for anything, you would not find evidence of any types of placenta inside of the mother. Also, you would have a cervix that was closed because there's nothing, the body naturally would close the cervix as there was nothing more to be passed through the mother. So that's important. We want to know what the cervix is doing, how it's responding to these different types of abortions. So think about that in your mind as I'm going over it. Make sure that you're hitting all of the parts about this concept. Missed abortions happen, and sometimes the mother does not even know that it happened, and sometimes they do know because they will have signs afterwards that the fetus is no longer viable. So products of conception are retained in utero after a fetal death, and so this can happen if a mom goes to the doctors, she has a heartbeat, and then the next time she goes, the heart is no longer beating, and the baby is still retained in utero. So this is a tough topic, especially if anyone who has experienced this. This can be a very traumatic and sensitive subject to discuss, even to hear about. So we're definitely doing this for testing purposes only, to pass your NCLEX exam, and our prayers go out to any of a woman who is watching this and struggling with this topic even still. Okay. Habitual abortions are type of abortions or miscarriages that occur in 3 or more consecutive pregnancies. So there's many different thoughts about abortions, if they're something that is acceptable or not acceptable. So here are just the religious choices for abortion. As far as the Roman Catholic beliefs, they do not believe in abortion. Judaism, abortion is accepted within the first trimester. In Islam, abortion only for serious reasons such as the health and well-being of the mother. Protestant Christianity, so that is all of the denominations that are related to Christianity, whether it is Baptist, Methodist, what else, Pentecostal. The Christian denominations, they have a mixed belief on abortions, whether it is okay or if it's a sin, just like any other, that can be forgiven. Hinduism, they have a long experience, a long history on abortions there. So it is essentially something that is, I don't know how to explain this. It is something that you can do because I don't even know. I believe that in the afterlife, if one was aborted, then life can continue on. But if you're practicing Hindu and I don't have that right, just put it in the comments and I'll be sure to go back and correct it. The Native American religion accepts abortions, and the Chinese religion also accepts the practice of abortions. So our nursing responsibilities for a patient who has an abortion is, again, maintaining bed rest, especially if there's bleeding. That is one of the things we want to absolutely do. Monitor the vital signs of the mother, right? And monitor for cramping and bleeding. Count and weigh the perineal pads for blood loss. So if you're weighing a pad for NCLEX, know that 1 gram equals 1 milliliter. And if during your care as a nurse, a woman passes any tissue or blood clots, those may want to be evaluated by the healthcare provider. So we would actually tell the mom to save those pads. And then intravenous fluids as prescribed, and monitoring for signs of hemorrhage or shock. Continuing on with nursing responsibilities, the nurse would be considering preparing the client for a dilation and curettage, such as if there was an incomplete abortion. And knowing about the dilation and curettage is going to be really beneficial. I'm gonna get through the slides, and then if I have to go back and explain it, I will go deeper into this. Administering RhoGAM, the Rh immune globulin, I should say that's the generic name, as prescribed for Rh negative patients, okay? And this is the mother. So that's also going to be important, knowing the timing of it. If you are in the virtual trainer, we go over the administration of the Rh immune globulin. And of course, psychological support, because this is a traumatic experience for a mother, okay? I want to just talk briefly about number 6, the dilation and the curettage. I want to give you guys the notes that I have for it. So this is a 2-part process where when we talk about dilation, what are we talking about? We're talking about the cervix being dilated, all right? And that is something that has to be done artificially. So normally in pregnancy, the cervix dilates because of contractions, because of pressure from the baby's head. It helps to open up the cervix. However, if you are, if a physician is wanting to get embryonic tissue or fetal tissue from the mother, then they have to open up the cervix, which is the dilation part. And there's like, a few ways to do it. And then they have to go and do the curettage, which is removing tissue. Okay. So that's what it means, to remove tissue. And that is a process that happens. And typically the dilation part of that can start a day before the removal of the tissue. So it should be a gradual process to dilate the cervix, and not something that is done quickly, because that can cause all types of issues. And then usually this procedure, the curettage, is done early on. I believe it's before 12 weeks, right? Because there's early abortions and then there's late abortions. And so this procedure is done specifically before 12 weeks is what I had on my notes. All right, I want to share that with you guys, so that if you read it, you kind of have context about what's happening. Okay, so we have gone over the content for abortions. Here are some practice questions just to see